Good, good afternoon, ma'am. My name is Joseph Byler. I'm going to be your nurse today. We're just conducting a health history assessment to kind of get a baseline for how you're doing for all of your upcoming appointments. Could you tell me today's date and time?
It's June the 7th, 2025, and it is 4:33 p.m.
Excellent. And what is your preferred language?
English.
Gotcha. Do you have any illnesses or any sort of medical disability that affects the activities of daily living?
I mean, I have type 2 diabetes. It doesn't really affect my activities in daily living.
Gotcha. What was your sex assigned at birth?
Female.
And what is your gender identity?
Female.
What are your pronouns?
She, her.
And what is your age?
52.
And where were you born? Where were you born and what is your birthday?
Searcy, Arkansas, September 26, 1972.
Nine 1972. What is your race and cultural background?
White.
That's about it, yeah, white. Gotcha. What would you say your religion is?
Christian.
And your marital status?
I'm married.
Wonderful. What is the highest level of education you've completed?
I have a master's degree.
Do you have any plans or desires to pursue any further education?
Probably not.
Are you currently employed, and if so, what type of work do you do?
Yes, I'm director of a TRIO program.
TRIO program. And TRIO, that's an acronym.
No.
No, not quite.
No.
I always thought that it was.
No.
Do you have any sort of concerns about your income or financial stability?
Yes. The TRIO programs are under fire by the current administration, and so there's a possibility we could lose our funding.
Yeah, it's been kind of a stressful time with all the changes going on lately, especially if you work in the Department of Education. Do you have stable housing, or have you had any issues with housing this past year?
No, I have stable housing.
Do you have a regular healthcare provider?
Yes.
Are there any barriers that prevent you from accessing healthcare?
No.
I apologize for typing away on here. Our form has a lot of, different options here. Do you have health insurance?
Yes.
Do you have reliable transportation to get to work, school, medical appointments, that sort of thing?
Yes.
Do you have easy access to grocery stores that sell fresh fruits and vegetables?
Yes.
Do you feel safe in your neighborhood?
Yes.
Are you involved in any community groups or activities?
Mostly church.
Do you have family or friends nearby who can support you if needed?
Well, I mean, I live with my husband and children, and I have friends nearby.
So now we're just going to be going into some of your past medical history. This will be questions about like hospitalizations, surgeries, that sort of thing. Have you had any previous surgeries, and if so, do you recall what dates those occurred?
I had my wisdom teeth removed. That would have been 33 years ago. And that's the only surgery.
Okay, so the only surgical history is a wisdom teeth removal approximately 33 years ago. Any hospitalizations, and if so, for what reason?
Just twice for having children.
Twice for having children, and what year were those?
1999 and 2005.
1999 and 2005. Any severe injuries or disabilities?
No.
Any major childhood illnesses, like if you got, I don't know, measles, mumps, anything like
no,
that?
I mean, I had chicken pox, but everybody did then.
Any chronic adult illnesses? I know that you said the type 2 diabetes. Anything else that you know of?
That's it.
Okay. There's going to be a whole sort of smattering of questions here for a sec. So this is, when was your last physical examination at the doctor?
A couple of months ago?
Gotcha. So like maybe January or?
No, like 2 months ago.
Oh, okay. So like March?
April, I
April.
believe.
When was your last dental exam?
I don't remember.
Me neither, to be honest with you. What about your last vision exam?
About a year ago.
Okay, so probably like June-ish of last year, or?
Maybe.
I know whenever you have glasses, you kind of go every year anyway. It all kind of blurs together. Have you ever had a colonoscopy or had your stools tested for the presence of blood?
No.
Have you ever had your cholesterol checked?
Yes.
And what were the results of that?
It's fine.
Yep. What am I doing here? Have you ever had a tuberculosis test?
Like for work.
Okay, gotcha. So how recently was that, and what was the result?
I think probably about 15 years ago was the last time I had to have one, and I mean, it was negative.
Okay, gotcha. I get tested like every year and a half, 2 years, something like that. And when was your last mammogram and pap smear?
It's probably been 4 or 5 years since I had a mammogram, and it's been a couple of years since I had a pap smear.
And what were the results of those?
They were fine.
Last pap smear. This is just going to be some questions about different immunizations that you may have had and when those occurred. Did you receive the annual flu shot this year?
Yes.
Do you recall whenever you last received your last Tdap? vaccine?
It's probably been more than 10 years at this point.
Did you receive the MMR vaccine?
Yes.
What about HPV?
I don't think so.
Have you received a varicella or chickenpox vaccine?
I don't think so because I had the chicken pox.
Gotcha. What about the hepatitis A and B vaccines?
Probably.
What about the COVID-19 vaccines and boosters?
I had the vaccines and I had the first booster.
Have you received the meningococcal vaccine?
Probably.
Gotcha. Okay, and then this one does not apply to you. It was a question for clients who are over 60 years of age, so does not apply. Do you use any over-the-counter drugs like vitamins, herbs, supplements, anything
No.
like that?
No.
What about prescription medications?
I take Manjaro and Prestige.
Manjaro. And how often do you take that, and what is the dosage of it?
It's once a week, and I don't know what the dosage is. It's again.
Weekly in pen form. And then what was the other medication that you take?
Prestige.
How do you spell that?
Pristiq.
TIQ. And same thing, dosage and schedule for that one?
I don't know what the dosage is, but I take it daily.
Once daily. Any allergies that you know of, including seasonal drugs, food, diet allergies, etc.?
I mean, just the normal seasonal allergies, but not anything that I take anything for.
Gotcha. So just like some mild seasonal allergies.
Right.
I take a Zyrtec every now and then or something. And this is going to be relating to your eating habits and appetite. Do you get, how many meals would you say you eat a day?
2 to 3.
2 to 3, and are they, what would you say the portion size on that is? Is it like a child-sized meal or like an adult-sized meal, or?
Probably somewhere in between.
Okay, and so this question is about your obstetrical history. How many times have you been pregnant?
Twice.
How many of those went to full term?
Twice.
So no premature, no spontaneous abortions or anything
No.
like that. And how many living children do you have?
2.
Wonderful. Alrighty, now we're getting into some of the emotional and psychological stuff. So that's always fun. What type of stresses or losses have you experienced in the past year?
Well, my dad killed himself in February, so that's the biggest one, and that would be the only one that's actually been in the past year.
I'm so sorry to hear that. Do you have a support system in place to help you deal with the situation?
Yes, and I go to therapy. I have virtual therapy. Telehealth.
Do you feel like that virtual therapy and telehealth has been helpful for you?
Yes.
Wonderful. Have you experienced any problems with emotional or mental illnesses?
Well, I'm taking Prestige, and that's an antidepressant and anti-anxiety.
Fatigue, depression, anxiety. How often do you see your therapist?
Usually weekly, occasionally it's every other week, but for the most part it's weekly.
Wonderful. So now we're going to get into some of your family history. So these are going to be like the health conditions of your family members. Anything pertinent that you can think of as far as family history goes?
Yes.
Gotcha. What do you got?
I mean, what, tell me what you need, like how far back do I go, what all do I tell you, what do you want?
I would probably go back only about as far as like your grandparents, because anything further than that, it's not going to be super pertinent. So like your mom and dad, your siblings, and maybe your grandparents is about as far as I would go.
Okay, so let's start with grandparents. So maternal grandparents, my maternal grandfather died from bladder cancer, and my maternal grandmother died from some kind of blood cancer. And then on the paternal side, my paternal grandmother died from complications of a stroke. My paternal grandfather he had heart disease, but like he was 97 when he died, so.
Right, so.
Relatively healthy. Then my parents, my father had colon cancer. He also had a quadruple bypass, so heart disease, high blood pressure, high cholesterol. My mother died from complications of pancreatic cancer, and she also had several strokes, so again, heart disease and dystonia. And obviously, my father had depression, and my mother as well.
Okay, so we've got a family history of bladder cancer on the maternal grandfather, maternal grandmother, blood cancer, paternal grandmother, stroke, paternal grandfather, heart disease, father, colon cancer, heart disease, depression.
Oh, and he also had skin cancer.
He also had skin cancer, so 2 different types of cancer. Cancer, heart disease, depression, and then the mother, you said liver and pancreatic cancer.
Yeah, it was Mets to the liver.
Mets to the liver. And then dystonia, stroke.
Oh, and diabetes. She had diabetes. Type 2.
Diabetes. And dystonia.
Yes.
And depression. I already said dystonia earlier. Pretty extensive family history then. Gotcha. Next we're going to go into some personal and social history for you. Do you use tobacco? And if so, how often?
No.
And no previous tobacco use in the
No.
past? Gotcha. What about alcohol use?
At the most, once or twice a week, but I also sometimes will go for weeks or even months at a time without any.
And then this is going to be about your diet. Do you have any dietary restrictions? Caffeine, lactose?
I try to eat low carb because of the diabetes, but other than that, not anything in particular.
Gotcha. If I could spell diabetes, though, this would be fantastic. There we go. And you said you are a director of a TRIO program for your occupation. Any hobbies?
I like to sing, like to hang out with my family.
To your knowledge, do you have any past or current environmental exposures to things like pesticides, lead,
Not that I'm aware of.
asbestos, etc.? Approximately how many hours of sleep would you say you get per night, roughly?
Probably 6 or 7.
What about any spiritual practices that provide support, like prayer, church services, reading spiritual literature, etc.?
Yeah, I read my Bible every day. And I go to church usually every week.
Gotcha. And then this is going to be some questions that are relating to like your functional assessment. It's going to be like some internal factors and then some external factors, just kind of a broad thing. This particular section is going to be focusing on like your self-concept, kind of how you think about yourself. So are you happy with what you've accomplished in life?
Yeah, for the most part.
Are you happy with your job and relationships?
Yes.
What is your highest level of education? I know we said the master's degree
Yes.
in earlier. I'm not sure why it asks that twice since we've already asked what your highest level of education was, but what have you. Do you have any learning difficulties to your knowledge?
No.
How would you rate your overall health?
I mean, other than the diabetes, it's actually pretty good. Because, I mean, I made it to 52 without taking any medications regularly.
Wonderful. So you would say that other than the diabetes and along with the anxiety and depression, you would say your health is pretty good overall?
Yeah, I mean, my vision is crap, but it's always been bad, so.
Right.
It's not
like a new concern or anything. It's been that way. Are you comfortable with your overall appearance?
Yeah, for the most part.
Are you comfortable with your sexuality?
Yes.
It's kind of an odd question, I realize. Yeah. Do you feel comfortable being yourself in different social situations?
I don't like being in big crowds, but I never have.
Gotcha. So not just like a huge people person.
Well, I mean, I'm fine with people if it's in small groups. I just don't like
You don't
crowd,
like
like crowds or parties or.
I get you. Yeah. I can empathize with that. I'm not a big party animal either. Some of these I'm just going to go ahead and fill out because we've already answered them earlier. Like this one was asking what types of stress have you experienced in the past year. We already discussed losing your father, so I don't know why it asked that again, but what have you. Any changes in lifestyle or relationships in the past year?
Well, yeah. I mean, if you go back a year and a half, is when everything really changed. Because my mom got sick, the cancer came back in January of 2024, and so from that time until she passed away in April, every weekend I was at my parents' house, and sometimes during the week, and that's 2 hours away. And then after she died, I started going to spend time with my dad at least once a month, sometimes twice a month. And then whenever he killed himself in February, I've been back and forth to Conway quite a bit with settling his estate. So, yeah, the past year and a half has been very, very different from before.
Gotcha. What methods do you use to reduce your stress levels?
Well, therapy has been the biggest help. I also also use the Finch self-care app. They'll remind me to do things like
Oh, the one with the little bird.
like,
That's cute.
to drink water, or take a stretch break, or different things like that. And then otherwise, just trying to spend time with my family.
And do you feel that these methods have been helpful in reducing your feelings of stress?
Yes, therapy for the most.
This next section is about like activity and exercise. So are you able to complete the daily tasks like getting dressed, bathing, getting to and from the toilet, walking independently, or do you need any assistance with that?
No, I don't need any help with any of that.
Are you able to prepare food and complete errands?
Yes.
And so we already said that you walk independently, everything. I'm assuming you don't use like a cane or a walker or anything
No,
like that.
No.
Are you able to navigate safely in your home and environment?
Yes.
How often do you exercise?
Almost every day. So I'd say at least 5 days a week.
Okay, wonderful. And what kind of exercise do you participate in?
I'll do the stationary bike or the treadmill, a little bit of weights, but more so on the machines.
Gotcha. So primarily cardio and then some strength training sprinkled in. How do you spend your leisure time whenever you're not at work or whatever?
Usually with my family.
Okay, this is going to be some more specific questions about your sleep. What would you say your like usual sleep pattern is?
Right now, I tend to fall asleep pretty early, somewhere between 8 and 9 o'clock, but I work 10-hour days, 4 days a week in the summer. So I have to because I get up before 5.
Gotcha. So if you're not working the 10-hour days, then you would go to sleep a little later, wake up a little later. Do you take naps during the day?
Only on the weekends.
That's the only time you have time, right?
Right.
Yeah.
I mean, it'd be bad if I did during a work day.
Yeah, that wouldn't be any fun. Do you use any aids to help you fall asleep? Medication, music, anything like that?
No, I take the Prestige at night, but I don't think that it has any kind of sedative effect.
Gotcha.
I use a noise machine.
Okay, yeah. Ocean sounds or something?
Right,
along
rain
those lines?
usually.
Oh yeah, well whenever it's rainy, that always makes me want to fall asleep. Do you have any spiritual traditions that you follow that you would like us to be aware of? Anything that would affect your care?
No.
How does your religious faith or spirituality guide your health choices and practices?
I don't know if it makes a difference or not. Like, I mean, I don't have like, I can't eat pork or, because of religious
Can't
convictions or
have
anything
blood
like
products
that.
or
No,
nothing
no.
fun like that. And you said that you participate in church services weekly?
Yes, most of the time.
You already said that you don't have any spiritual or religious preferences that we would need to address. Right.
Not that I can think of.
I feel like we've already discussed most of these. It's just questions about like substance use. It's asking about your patterns of alcohol consumption, which we had already addressed. Um, and then tobacco use. Do you use any other medications for for a non-therapeutic reason?
No, no.
Marijuana, cocaine, ecstasy, nothing crazy.
No.
Okay, gotcha. I mean, I'm not a narc, so like, I'm not gonna tell the cops or anything like that. Mostly we just ask those questions so that we know if anything's going to interact with any medications that you might need. So, and then this is questions relating to how your occupation affects your health. Does your occupation expose you to any health hazards like noxious fumes, fertilizer, or other chemicals?
No.
Any risk for injury due to moving machinery or heavy lifting?
No.
Do you wear protective personal equipment, earplugs, goggles, gloves?
No.
Do you feel that your job responsibilities are stressful?
Yes.
How would you describe your interactions with coworkers?
Well, I'm the boss, so, but I feel like they like me and respect me. We all get along well.
Does your employer have educational programs and monitoring in place to support employee health?
Yes.
And do you take advantage of these offerings?
I haven't needed to. They like I think that they offer like 4 free therapy sessions, but I've used Military One Source.
Gotcha. So you haven't needed to use these resources because you've got additional resources.
Right.
Okay. I think we're getting relatively close to the end of my assessment. I know there's a couple big long sections left, but we'll kind of just go through it as we go. So this is about your living environment. Are there working smoke and carbon monoxide detectors in your home?
Yes.
Do you have any dimly lit areas or throw rugs in your home that could lead to falls?
No.
What type of heating and cooling systems are used in your home? Are there like any open flue gas heaters or anything like that?
No.
Gotcha. So is it like electric? Or?
Yeah, just electric.
Does your home setting have any known exposure to hazardous substances like lead paint on the walls or asbestos?
No, not that I'm aware of.
Some of those older homes you gotta watch out for. Do you have access to fresh water and sewage services?
Yes.
Do you consider your home to be a safe place for you?
Yes.
Do you feel safe in your neighborhood? I think we already talked about that.
Yeah.
Yeah. Have you been exposed to violence within your community?
No.
Do you have access to needed services such as fresh food, transportation, and healthcare? We already talked about that.
Yeah.
Yeah.
Yeah, we already talked about
I don't
that.
know why there's so much repetition in this, but you know. Does your neighborhood have a problem with air pollution or noise pollution?
No.
Around here especially, you know, a lot of us kind of live out in the country. Okay, this is about your relationships. What is the relationship of those who live with you in your home?
My husband and my 2 children.
How would you describe your role in the household?
The mom.
Gotcha. Do the individuals within your household get along with each other?
Sometimes.
Sometimes. I hear that. 2 kids at home. Is there a family member or friend that you could reach out to if you needed help or support?
Yeah.
Is there anything or anyone that prevents you from socializing or participating in groups as much as you would like?
No, but I don't want to participate in very large social settings or groups anyway.
Well, that's still participating as much as you like to, so
Right.
yeah. The answer for how much you like to can be none at all. So this is about. So this is going to be some questions about like potential maltreatment. In the last year, have you been hit, kicked, punched, slapped, choked, hurt, or threatened by someone?
I've been threatened, but that was at work, and the campus police escorted the person off property.
Gotcha. So that was like a disgruntled student, or what was going on with that?
Disgruntled almost student, potential student, previous student.
Gotcha. Are you fearful of your partner or someone else in your home?
No.
Are you afraid of anyone with whom you have had a previous relationship?
No.
Do you ever feel pressured to do something that you did not want to do or felt uncomfortable doing?
No, I don't think so.
Do you feel that anyone is hurting your health, safety, or well-being?
No.
Has your okay, those don't apply. That was about like elder abuse or disabled adult treatment, which doesn't apply to you. And then these we've already kind of gone over. You're independent for ambulation. You don't need any assistance getting up to walk. Same with going to the toilet and transferring in and out of chairs. Same with eating, I'm assuming.
Right.
Gotcha. Any changes, like sudden weight change, weakness?
Yes. I mean, I lost about 20 pounds, but that's because of taking Manjaro.
Gotcha. Any feelings of fatigue or fever or anything like that?
No.
Gotcha. Any skin changes that you know of? Rash, lumps, sores, etc.?
No.
Any headache, head injury, dizziness?
No. Well, if my blood sugar is starting to get too low, if it's been too long since I've eaten, then I start to feel dizzy.
Okay, gotcha. Any vision changes?
No.
Just the corrective lenses?
Right.
Any hearing changes that you know of?
No.
Any trouble with cold, congestion, runny nose, and etc.?
No, just, I mean, if pollen was bad outside or something.
Any trouble with bleeding gums, dentures, sore throat, dry mouth?
No.
Any trouble with your neck, pain, lumps, swelling, etc.?
I mean, I'll have some neck pain. I have scoliosis also, but I've had that since I was a kid.
Any trouble with lumps, pain, or discomfort with your breasts? Anything new with that?
No.
Any cough, bloody sputum, difficulty breathing, wheezing, anything like that?
No.
Any chest pain or discomfort, heart palpitations, waking up at night short of breath?
No.
Any change in appetite, feelings of nausea, vomiting, trouble swallowing, heartburn?
Yes, but that's from the Manjaro. I'm not as hungry.
Any trouble with urination, like urinating at night, urgency, anything like that?
Well, I have to get up at night at least once, sometimes twice, but that's been for a long time.
Gotcha. This is a little, possibly a little bit awkward of a question. Any trouble with your sexual habits or anything like that?
No.
Cool, good. That one's not applicable. Do you remember, so this is about like the female reproductive cycle. Do you remember whenever you like started menstruating?
I was 13.
And do you have like a regular cycle?
No. It's been at least the past 2 years, maybe longer, that sometimes I've gone as much as 6 months without one.
Gotcha. Some like premenopausal stuff going on here.
Right.
Any other concerns as far as that goes?
I'm just ready for it to stop altogether.
Any trouble with leg cramps, varicose veins, history of blood clots?
No.
Any muscle or joint pain, stiffness, or limitations with your range of motion?
I mean, I don't have stiffness in my back and neck, but again, I've had that since I was a kid.
Gotcha. Any trouble with fainting, seizures, weakness, paralysis, numbness, tingling, tremors, involuntary movements?
No.
Any history of anemia or easy bruising, history of blood transfusions?
No.
Any history of thyroid trouble, hot, heat, or cold intolerance, sweating, polydipsia, which is excessive thirst, excessive hunger, excessive urination, anything like that?
I mean, I'll have the occasional hot flash, but I mean, I don't know. I'm assuming that's just perimenopause.
Most likely. So we know for sure. Yeah, any history of nervousness, anxiety, and depression. I know we said that you've been
Yes.
medicated for. Any memory changes, history of suicide attempts?
No.
So just the anxiety and depression. And that is it. That concludes our interview here. Thank you for asking all of my questions. I'll just put this in our file and we'll be able to have it all in your chart for your future visits.
Okay.